Thank all of you for coming. I'll acknowledge my own Surgeon General who's in the audience and the Surgeon Generals who are up on the stage. We are honored by your presence. We appreciate your service to our country. We appreciate your service to the people of our state in particular who have benefited from many of the policies that you have helped oversee throughout the course of your respective days in that august office. I'm just here for a short time to tell everybody that I appreciate their involvement and their participation, to salute the Minority Health Commission, and to emphasize one of their many missions and their many obligations. That one area is in the area of health education. I could spend all day up here talking about the various aspects of what the Commission's charge is and what the people in this audience provide in the way of services to our people, both in planning and policy as well as in implementation. But I think it's particularly important at this hour, at this day, in this time, that we emphasize the opportunity that exists to use this commission and this office to help educate our people. And when I'm talking about educating our people, I'm talking about educating them on healthy lifestyles. And the reason that's particularly important right now is that regardless of whether you were for or against the Health Care Act in the Congress, whether there are aspects of it that are to you beneficial or to you less than beneficial, and frankly, you've heard me talk about both sides of that equation because there's some things about it I think are really good and there's some things about it I don't like. But wherever you stand on it, there's one aspect of it that I think all of us need to understand that is both a challenge and an opportunity for us. For the next few years, the obligation on our state with increased Medicaid eligibility will be borne by the federal government. Now, we all are federal tax-paying citizens, and we all have an obligation to concern ourselves about that. But I have to tell you that my chief concern, because I'm elected to it, is the state obligation and the state budget. At some point down the line, obviously it will probably, under current projections, be long after I'm gone, whether I'm here for a few more months or whether I'm here for a few more years, it will become a greater obligation of the state. We have an opportunity over the next few years to impact that obligation, to lessen, if you will, that obligation. We have the opportunity to lessen that obligation with good public policy by making people healthier now, so that they don't have to utilize as much of the services of our state in paying for health care costs going forward. You see, if we can educate people to make healthy choices in their lifestyle, in their diet, in regular checkups, in prevention, in early diagnoses, in early treatment, if we can do all that now, then we lessen the chances that they will need more extensive and more expensive health care services down the road. That's not only good for our taxpayers, it's good for our people. If they are healthier, they are happier. Their families are happier. Now here's a undisputed and disturbing fact. There is a direct correlation between health illiteracy and poverty. People who live in poverty have less of an understanding about health literacy, what it takes for them in their decision-making process to live better, to live smarter, to live healthier. That's why I wanted to highlight this morning what I believe is so critical at this stage in our national and state development of the role of the Minority Health Commission. If indeed we can do a better job in educating people in poverty, and incidentally there's a higher correlation between people in poverty and the minority community in our state, if we can do a better job of educating our people in poverty about these choices, these decisions, these options, these opportunities, then the Health Commission, Minority Health Commission, will have taken a great stride in providing a service to our people, both who are the direct beneficiaries and recipients of this education and this healthier lifestyle, and to the rest of the population of our state who are paying the taxes to help care for our sick people. Now, by making this point, I don't in any way want to denigrate any of the other responsibilities and mission of the Minority Health Commission, because they have an even greater, as the rest of our state healthcare community has, to be able to provide services in a variety of other venues, other arenas, other activities, and other disciplines. They have a greater responsibility than merely to educate. But highlighting the need to educate our population that's most directly affected by these unhealthy choices and unhealthy lifestyles is a major component of what this commission's all about and what all of us should be all about. Am I guilty of bad choices? Absolutely. Should I do better? You betcha. Don't do as I do, do as I say. One quick anecdotal story about this, and I'm almost ashamed to admit this, especially in front of these surgeons general. You all know my wife. She's, in fact, I'm really getting irritated because everywhere I go, they say, "Governor, it's really nice to see you, but we came to see Ginger. Is she not here?" She weighs 96 pounds. She exercises. She eats rabbit food, you know, nuts and berries and lettuce. Her cholesterol is over 200. In a moment of confession, I will tell you that I eat red meat, and fried potatoes, and biscuits and gravy. And my cholesterol is 135. Life ain't fair. She reminds me of that all the time. A lot of this is hereditary, and a lot of things we can't change. We're stuck with the genes the good Lord gave us and our mama and our daddy provided for us. But there are some things that we can change, and some things that we can do, and some things that can improve who we are, where we are, and how we live. And to the extent we have those options available to us, it's an obligation for all of us to try to impart to our people, particularly our people who need the education the most, particularly people in poverty who are disproportionately living unhealthy lifestyles, that there are choices and options out there that are better for them and better for all of the rest of our society. That's all I wanted to say. I could have said it in 2 sentences, but you wouldn't have paid me as much as you're paying me for saying it. I applaud all of you who are interested and concerned about this issue. We will embrace our obligations and our challenges as all Americans do, with pride and dignity, with responsibility and reasonableness, and we will lead our state because it's the right thing to do, and it is what we're elected for, what we're appointed for, what we're hired for. Whatever your capacity is, we all owe one another our best efforts. And our best efforts include helping, protecting, and educating those among us who are most vulnerable, those among us who need our help the most, those among us that, but for the grace of God, we would be. Thank you.